Shingles. When most people hear that word, they probably just picture a really painful rash, right? But what if I told you the real story is, well, it's way deeper than that. And it all starts with a ghost from your childhood.
I mean, really think about that for a second. An illness you totally beat as a kid is just hanging out, dormant, for decades, waiting for a chance to come back and get you. It sounds like something out of a horror movie, but that is the unsettling reality of shingles. So let's dig in and figure out how this even happens.
Okay, so to really get a handle on shingles, we've got to rewind the clock. We're going way back to a classic childhood illness I'm sure many of you remember, chickenpox.
All right, the main culprit here, the villain of our story, is a thing called the varicella zoster virus, or VZZ, because that's a mouthful. Now, here's the crazy part. After you get over chickenpox, this sneaky little virus doesn't just, pack its bags and leave. Nope. It finds a nice cozy spot in your nerve cells and basically goes into hibernation for decades.
But, and here's the but, if your body's defenses get a little weak, maybe you're getting older or you're sick with something else, that sleeping dragon can wake up. And when it does, it travels right back down those same nerve pathways to your skin. And that's when it reemerges as shingles.
And this is where the story gets really tricky. Because long before shingles ever shows up on your skin, it's waging this secret war inside your body. And honestly, it creates an absolute diagnostic nightmare for doctors.
So get this, before you see a single blister, a single red spot, anything, the virus is already on the attack, going after your nerves. This triggers this incredibly intense, localized pain. We're talking burning, stabbing, but there's nothing there. You look at the skin and it's completely normal. It's a total phantom menace. It even has a name, preherpetic neuralgia.
And this is where it gets genuinely scary. Just look at this list. Depending on where that invisible pain decides to show up, it can perfectly mimic a heart attack or appendicitis or any of these other major emergencies. You can see how this sends doctors on a total wild goose chase, right?
You have to understand, every single hour that goes by during this invisible pain phase is absolutely critical. A misdiagnosis isn't just about a patient being in pain for longer. No, it's way worse. It means a delay in getting the right treatment. And that delay, well, that's what opens the door to the most feared complication of shingles, a potential lifetime of chronic pain.
But this is where science is stepping in with some real hope. Researchers are starting to pinpoint specific proteins in the blood, things like PLG, F2, and VTN, that spike during this pre-rash phase. Think about what that means. If they can find a reliable biomarker, it could lead to a simple blood test to catch shingles early. We could start treatment before the rash even thinks about showing up.
So after all that invisible drama, eventually the virus decides to show its face. We're usually talking about 2 to 5 days after that initial pain kicks in.
The whole thing follows a pretty clear timeline. First, you've got that prodromal pain. That's the fancy term for the pain before the rash. Then, boom, the acute phase hits, and that's when the classic blistering rash shows up. As that rash starts to heal, some people move into what's called a subacute phase, where the pain just lingers. And for the really unlucky ones, that pain sticks around for more than 3 months, turning into a full-blown chronic condition.
And if you want to see what that lingering pain looks like in actual numbers, just check this out. At the 3-month mark, nearly 1 out of every 5 patients is still feeling pain. 1 in 5. Fast forward to a full year later, and it's still hanging on for more than 7% of them. So yeah, the rash is long gone, but for many, the pain is a very real, unwelcome guest that just won't leave.
This brutal, long-term condition has a name, postherpetic neuralgia, or PHN for short. At its core, it's nerve damage. The reawakened virus has literally injured the nerves, and that kind of pain can be incredibly, incredibly tough to treat.
So okay, the rash finally appears, the diagnosis is clear as day. What now? Well, now the clock starts ticking, and I mean it's ticking fast. It becomes a desperate race against time to get that virus under control, and hopefully prevent that devastating long-term nerve damage.
72. Remember that number. 72 hours. That is the magic window. For antiviral therapy to have the best shot at knocking down the severity of the illness and slashing the risk of PHN, it has to start within 72 hours of that rash first showing up.
And this right here, this is basically the battle plan. The number one priority, hit the virus hard and fast with antiviral drugs. But at the exact same time, you've got to manage that intense pain. That means throwing everything in the arsenal at it, from simple painkillers all the way up to more specialized nerve pain meds.
But what happens if that 72-hour window gets missed? Or what if, even with the right treatment, the pain just refuses to leave? Well, that's when the fight changes. The focus has to shift from fighting the acute virus to managing chronic PHN.
And we have a pretty good idea of who's most at risk for developing this chronic pain. The odds go way up with age, for sure. It's also a higher risk for women, anyone with a weakened immune system, and, this is a big one, people who had really severe pain or a really nasty rash during that initial acute phase.
So treating this kind of chronic nerve pain, it requires a whole new playbook. We're no longer just fighting the virus. Now the focus shifts to specialized medications designed for nerve pain, topical treatments like lidocaine patches or creams, and yeah, in the really tough cases, you might need even more advanced pain management techniques.
And you know, all of this really brings us to what might be the single most important point of this entire discussion: prevention. I mean, the absolute best way to dodge the whole nightmare of shingles and PHN is to just not let the virus wake up in the first place. And thankfully, modern vaccines are ridiculously effective at this. They basically supercharge your immunity to VZV and help keep that sleeping dragon locked away for good.
So, as we wrap this up, I want to leave you with a final thought. We know our population is getting older, right? And that means more and more people are going to be at risk for shingles. Now, vaccination is obviously our #1 shield. But could cracking the code of that early diagnosis, finding the virus before the rash ever appears, could that be our ultimate secret weapon against the lingering, devastating pain of shingles? Something to think about.